Hello. Hi, how are you? You know Aaron, right?
Yeah, I know Aaron.
Hi, Frank. Good morning.
This lady has a history of compression fractures, and right now she has one that's been troubling her for the last 3 to 4 weeks and has severe pain at this point. And we're going to be bringing her into the operating room today and performing a procedure called a kyphoplasty, where we place cement into the fractured bone and take away her pain almost immediately. Marion, I'm going to press you back. Tell me if this is where the pain is.
Oh, yeah.
Oh, I'm sorry. And how about down here? Not too bad, right? But here?
Yeah.
Okay. All right, Mike. All yours. Oh, well, the old methods were big operations where the back was opened up. Actually, if conservative measures failed, then sometimes people would be in body casts for 3 to 6 months. 2001 is when this procedure came to this country. It was done in Europe for years, and it's a percutaneous procedure, meaning we place a needle through the skin, through a tiny incision, maybe a 1/4 centimeter long, and put a needle into the bone and inject cement.
My name is Jason Brosniak, spine consultant. This is my colleague Ronnie Keskinian with Medtronic. And what's interesting about this particular procedure is the fact that it's done radiographically, and it's through 1 or 2 very small incisions.
How's that there? What we're doing now is drilling into the bone. How's that there? An AP done?
Close to the envelope.
AP?
Yeah, because it's scoliotic and if you can angle up with it.
And open up a little cavity that the cement can go into safely. With other techniques where you don't use the balloons, it just spreads straight into the bone and sometimes can go in a haphazard fashion.
It'll get you a little lower on the bottom.
Reducing a fraction. Captain's going to mix the cement.
National County's a whole different ballpark.
Okay, so now we're going to slowly put the cement in. That one's right at the midline.
Always look solid.
How's that? See, what happens now, what causes the pain, Aaron, is the microfractures of the bone, and this cement's stable. Once it hardens, and it takes less than an hour to cure, it's like a 2-part epoxy glue almost. And it just stabilizes the microfractures, and the pain goes away.
That's your diamond.
And if this is too tight, you can make it looser. I can't stand this tucked under like that.
Procedure, and there were certain flaws in the study, and their conclusion was that the procedure doesn't work. But when you really looked at the study closely, it wasn't designed for it.
What brought these articles about? Like, why are they writing about it now?
Well, I mean, they're clinical studies. From time to time, people, researchers will just pick a certain type of procedure. Possibly it could be a procedure where they're targeting maybe cutbacks. Although I don't think this particular procedure is one of those. In the past, things like cataract surgery, open heart surgery had serious cutbacks from the Medicare reimbursement point of view. But the researchers obviously picked this topic and said, okay, does this work better than conservative measures? But those of us that do this procedure almost on a daily or weekly basis can tell you that we have patients out there that if this procedure weren't done, would be in chronic pain. Important thing, it works. The patients do better. This woman should be back on her feet this time tomorrow, and it's like nothing happened.